In the name of Allah, the most merciful, the most compassionate, we are going to discuss today one of the very oldest diseases that inflicted the humanity. It is a very old disease that started 100 years before BC, and Hippocrates wrote about it in his papers. This is the gout, sometimes called the disease of the kings or of the rich. It was called gout because it came from the old word gotta, which means drop by drop. Because at that time they thought that this disease is caused by a poison that goes inside the body drop by drop until the patient is incapacitated. However, this disease is caused by a very simple reason, which is the increase of blood uric acid level, and this is the trigger or the start of this inflict. We have two phases of this disease: the chronic disease and the acute disease. It usually affects men, and they are middle-aged, they are obese, they drink much of the alcohol, and they eat much of some food that we are going to discuss later. But anyway, it can affect any other man or even woman. It usually starts by an acute attack. The patient feels pain, severe pain, the severest pain you can ever imagine. And it usually starts in his big toe, which is swollen, red, and looks like inflamed, and is very painful. Sometimes the patient cries if they just put the blankets over his foot. Some of the patients ask the doctors to cut even their legs just to take off this pain. It is a very severe pain. This pain remains for 3, 4, or 5, sometimes 6 days, and then it goes away by itself. Or, of course, it can go earlier if the patient takes the proper adequate treatment. After that, everything disappears and the patient returns normal and lives normal and so on. And after a few months or even few years, another attack comes. And consequently, attack after attack, the attacks come in more frequent with less gaps between them, and the patient is going to enter into the chronic phase. These attacks, of course, can be, we can fight it, we can make it for less time, and we can make it for wider intervals between them by some treatment, which is the lifestyle and the medicines. Of course, the patient, when he has the acute attack, the first line of treatment is to have rest. Of course, the local treatment is contraindicated. Sometimes the patient uses to do friction or massage the painful toe, and this is contraindicated. Sometimes the patient takes, or he says, I have pain, I have to take some coffee and it will go. On the contrary, it is much more worse because it is contraindicated and it flares the pain more and more. So the proper treatment will be treatment of to standardize or to minimize the level of uric acid in blood. Some theories used to say that if you try to decrease the intake of the main sources of uric acid, which is the purines, in the diet of the patient, then he will not have the uric acid level increased in his blood. But this proved to be absolutely wrong, because it is due to an error inside his body which makes the level of uric acid increases in spite of the fact that he might not have lot of uric acid or purines in his food. It is very important to take care of the health of the patient and the uric acid blood level in between the attacks, because we want to have some protection for his kidneys to prevent formation of stones and so on. Now we come to the important point of food. Of course, this evil of alcohol is absolutely contraindicated to the gouty and, of course, the non-gouty people. But it is the trigger that makes it flare in his body. Sometimes they advise don't eat anything with the color brown. In Ramadan, the gouty people, if they have severe cases of gout, they have a license to break their fasting, because the gouty patient has to take a lot of fluids to the extent that he passes 2 liters of urine every day. And so he must drink a lot of water or any other soft drinks so that he lets his kidneys work and there is no fear of formation of stones. The other contraindication is the fool. People think that it is the disease of the rich because they eat much meat. No, it is also the disease that affects the poor who eats much fool. Beans, which has 2 parts, any bean which is formed of 2 parts is contraindicated for gouty patients. And on the top of them, our favorite meal, especially in Holy Ramadan, the fool. So, unfortunately, the gouty people has to stop this fool. Also, those things that we take in between the meals or between the fasting and the suhoor, the breakfast and the suhoor, like Sudani, like all these foods are also contraindicated. So we have to depend on vegetables, on fruits, and on much liquids. And one advice about these vegetables and fruits, usually try to eat it fresh. Of course, if you have preserved food like this, it lives longer than the fresh fruits and vegetables. It lives longer because it is dead already, because it has some preservatives added to it, which might be harmful, especially to some gouty people. So we are advising you that you protect yourself by allowing yourself to fast if you are a gouty patient, but you don't have the acute attack, or you have not so many chronic attacks coming frequently to you. Thank you, and Assalamu alaikum wa rahmatullahi wa barakatuh.